Have you ever noticed how, as we age, some things we used to do without even thinking twice suddenly feel a little harder? Maybe it's bending down to tie your shoes, climbing the stairs, or just enjoying a long walk around the neighborhood. And you might think, well, I'm getting older. It's normal, right? But here's the thing. Getting older doesn't mean you have to lose your strength, your independence, or your joy in life. In fact, your best years could still be ahead of you if you know how to protect the very foundation of your body, your bones. Right now, millions of seniors are quietly losing the battle against bone loss, experiencing painful fractures from simple falls, and facing the anxiety of losing their independence. And chances are, you or someone you deeply care about could be one of them. We've all heard the advice, take your calcium supplements, drink your milk, and yet, even with all that calcium, osteoporosis rates are skyrocketing. Why? Because calcium alone isn't enough. Let me share something most doctors don't talk about, something I wish I knew sooner. There's another mineral, one that's crucial yet often completely overlooked, even forgotten by mainstream medicine. This mineral doesn't just help your bones, it can actually reverse bone loss, rebuild strength, and keep you active and confident well into your golden years. And no, it's not some expensive pill or complicated treatment. It's something simple, affordable, and incredibly powerful. And today, I'm going to show you exactly what it is, how to use it, and why it might be the single most important health decision you'll ever make. If you're tired of feeling fragile, worried about falls, or simply want to enjoy your life to the fullest, pay close attention. Your strongest, healthiest years are just ahead. Let's reclaim them together. Ready? Let's discover this forgotten mineral together. First, let's talk about what's really happening with your bones and why it's so important we address this right now. As we age, especially after we cross 50 or 60, our bones naturally start to lose their density. Doctors call this osteopenia, and when it gets severe, osteoporosis. But let's skip the complicated words for a moment and simply understand what this means for us personally. Our bones slowly become thinner, weaker, and easier to break. And the real trouble is, we usually don't even notice this until it's too late. It's a silent issue that creeps up on us without warning. Think about this. Did you know that 1 in 3 women and 1 in 5 men over the age of 50 will experience a fracture related to weak bones? These aren't just statistics. They're real people, grandparents, neighbors, friends, who suddenly find themselves struggling with pain, loss of independence, or even needing constant assistance, simply because their bones were quietly weakening all along. I bet you can think of someone right now who's had a fracture from a simple fall, maybe just tripping over a carpet or slipping in the kitchen. It happens all too often. And sadly, these fractures aren't just inconvenient, they can be devastating. A single fall can mean months of painful recovery, costly medical bills, and worst of all, losing the independence and freedom we value so much. Suddenly, simple tasks like gardening, going out with friends, or even playing with grandkids become daunting. But here's the good news, it doesn't have to be this way. Just because it's common doesn't mean it's unavoidable. Bone loss isn't a life sentence, it's something we can fight and even reverse if we take the right steps. And that's exactly what we're going to cover next. Smile warmly, tone shift slightly more positive, building hope. Because despite what you might have been told, taking calcium supplements alone isn't going to fix this problem. In fact, relying only on calcium might even be part of the issue. So what's missing? What exactly are our bodies craving to finally rebuild strong, resilient bones? Well, let's dive into the surprising truth and introduce you to the incredible mineral your bones have been begging for all this time. Now let's talk honestly about calcium. For years, decades even, we've heard the same advice over and over again. Want strong bones? Take your calcium, drink plenty of milk, eat cheese. And if you're like most seniors, you've probably been diligent about following that advice. After all, it seems straightforward, right? But here's the puzzling part. Even though seniors today consume more calcium supplements than ever before, bone problems like osteoporosis aren't decreasing. they're actually on the rise. Brief pause, emphasizing the mystery. Why isn't calcium alone working? Well, think about calcium like bricks in a house. They're absolutely essential, yes. But what if no one ever told you that to build a strong house, bricks alone aren't enough? You also need mortar, beams, and supports to keep everything sturdy and secure. Similarly, calcium alone isn't enough to truly build and strengthen your bones. In fact, relying solely on calcium supplements can sometimes lead to other health problems, like calcification in your arteries. That means your calcium might end up in places you don't want it, like your heart or blood vessels, instead of building strong bones. And this confusion has left millions of seniors frustrated, wondering why they're doing everything right, yet still experiencing weakening bones and frequent fractures. But here's the good news. There's another piece of the puzzle, another essential mineral that makes calcium actually do its job properly. This mineral helps your body direct calcium exactly where it's supposed to go, into your bones, not your arteries. Yet, surprisingly, very few doctors even mention it to their patients. So, let's finally uncover this forgotten mineral and discover how it could be the game changer you've been waiting for. So, what exactly is this forgotten hero that's been quietly waiting to help you build stronger bones? It's a simple mineral called magnesium. Now, maybe you've heard of magnesium before, but chances are you've never really been told just how crucial it is. Not just for your bones, but for your overall health and energy. Magnesium is like the unsung hero of minerals. Your body relies on it for over 300 different processes, from keeping your heart beating strong to helping your muscles relax at night, and even managing stress and improving your sleep quality. But here's the amazing part, especially for seniors. Magnesium is absolutely critical for healthy bones because without it, your body struggles to properly use calcium. Think of magnesium as the conductor of an orchestra. Without it, calcium can't find its way into your bones effectively. Magnesium helps direct calcium straight into your bones, making sure it strengthens them rather than depositing it into your arteries or soft tissues. Yet, shockingly, nearly 75% of seniors are deficient in magnesium and don't even realize it. And when we're deficient, our bones quietly start losing strength and density, leaving us vulnerable to fractures and falls. Why is magnesium so overlooked if it's so vital? The problem is, magnesium isn't often emphasized by doctors or health professionals. It simply doesn't get the same attention as calcium or vitamin D, even though countless scientific studies show that increasing your magnesium intake can dramatically improve bone health, sometimes within just a few short months. But the best news? Fixing a magnesium deficiency is incredibly easy, affordable, and safe. In the next few minutes, I'll show you exactly how magnesium works, what type of magnesium you should be using, and even how to quickly spot if you're magnesium deficient right now. This might just be the single easiest, most impactful health step you ever take, and your bones, your body, and your future will thank you for it. Let's jump right in and see exactly how magnesium can start rebuilding your strength from the inside out. Now, you might be wondering, okay, magnesium sounds promising, but how exactly does it reverse bone loss and make bones stronger? Great question. Let's simplify the science in a way that makes sense for everyday life. Think of your bones as a living, breathing system. Every day, your body naturally breaks down old bone tissue and builds new tissue. As you age, unfortunately, that balance often shifts and the breakdown becomes faster than the rebuilding. Here's where magnesium steps in to save the day. First, magnesium helps your bones absorb calcium better. You could take all the calcium in the world, but if your body doesn't absorb it, it's practically useless. Magnesium activates vitamin D, which in turn significantly increases how much calcium your bones actually absorb. Essentially, magnesium opens the door so calcium can truly strengthen your bones instead of going to waste. Second, magnesium stimulates specialized bone-building cells called osteoblasts. Imagine osteoblasts as tiny construction workers diligently repairing your bones every day. Magnesium essentially wakes these little workers up, helping them build stronger, denser bones at a faster rate. Without magnesium, these cells get sluggish and your bones gradually weaken. Third, magnesium keeps calcium from ending up in the wrong places. Remember earlier when we talked about calcium potentially clogging your arteries? Magnesium acts like a traffic controller, guiding calcium directly into your bones and keeping it out of your arteries, joints, and other places it doesn't belong. This not only protects your bones, but your heart and arteries as well. But perhaps the best part is how quickly magnesium can make a difference. Studies show seniors who start supplementing magnesium can often see measurable improvements in bone density within just a few months. Some seniors even notice differences in their energy levels, muscle strength, and overall well-being almost immediately. Imagine feeling stronger, more confident, and more independent just by adding this one mineral into your daily routine. And the best news of all, it's simple to do. Now, before we jump into exactly how to easily increase your magnesium, let's quickly see if you might already be deficient, because most seniors are without even knowing it. Now, at this point, you might be thinking, how do I even know if I'm low on magnesium? Great question, because recognizing the signs early can make all the difference. The tricky thing about magnesium deficiency is that it tends to sneak up on us quietly, showing itself in ways that we often brush off as just normal parts of getting older. But let me share with you some clear, common signs that your body might be desperately needing more magnesium. First, do you often experience muscle cramps or spasms? Ever wake up at night with a sudden painful cramp in your calf or foot? Or maybe your muscles just feel tight, achy, or restless, especially in the evenings. Magnesium plays a crucial role in helping your muscles relax. So if you're feeling tense or stiff more often than not, your body might be asking for magnesium. Second, how's your sleep been lately? Do you find yourself waking up frequently at night or having trouble falling asleep in the first place? Magnesium is known as nature's relaxation mineral because it helps calm your nerves and muscles, allowing you to drift off into deeper, more restful sleep. A lack of magnesium could easily mean restless nights and tired mornings. Third, are you feeling anxious or unusually stressed out? As we age, stress and anxiety often become more common, but magnesium deficiency can amplify those feelings significantly. Magnesium helps balance your nervous system, calming your mind and body naturally. If anxiety seems to follow you around, even for minor things, your magnesium levels might be too low. Fourth, have you noticed your blood pressure creeping upward? High blood pressure is often associated with aging, but magnesium actually helps relax your arteries, improving circulation and naturally lowering blood pressure. If your numbers have been higher than usual, it could be your body signaling that you need more magnesium. And finally, have you noticed more fragile bones, brittle nails, or frequent dental issues? Your body prioritizes essential processes first. So if your magnesium levels are low, your bones, nails, and teeth are often the first places you'll notice the difference. If your nails chip easily or your teeth feel sensitive, this could be a subtle sign your body is crying out for magnesium. Now, don't worry. If any of these symptoms sound familiar, the solution is simple and straightforward. Magnesium deficiency is incredibly common among seniors, but fortunately, it's also one of the easiest health issues to fix quickly. Let's dive into exactly how to choose the right magnesium supplement and how much you'll need to start rebuilding strong bones and regaining your vitality. By now, you're probably thinking, okay, I definitely want to boost my magnesium, but where do I even start? Great news! It's easier than you might imagine. But first, it's important to know that not all magnesium supplements are created equal. Choosing the right form is key to making sure your body gets the maximum benefit. Let's quickly look at the top forms of magnesium for seniors, so you can start seeing real results right away. 1. Magnesium glycinate, your best option. If you remember just one thing from this video, let it be this. Magnesium glycinate is the gold standard. Why? It's incredibly gentle on your stomach, easy to absorb, and highly effective. Seniors love magnesium glycinate because it doesn't cause digestive issues or discomfort, meaning you get all the bone-strengthening benefits without side effects. Ideal dosage, around 200–400 ml per day, is usually perfect for most seniors. Pro tip: take magnesium glycinate about 1 to 2 hours before bed for deeper, more restful sleep. 2. Magnesium citrate, another great option. If you prefer an affordable yet effective choice, magnesium citrate is another excellent option. It's highly absorbable and provides an added bonus of gently helping digestion, especially if constipation is occasionally an issue. Ideal dosage, typically 200–300 ml daily. Note: start slow as higher doses may slightly loosen stools. Which form should you avoid? Watch out for forms like magnesium oxide, which you'll often find cheaply in grocery stores or drugstore shelves. While affordable, it's very poorly absorbed, meaning most of what you take won't actually strengthen your bones, wasting your money and your time. Your best bet is to stick with magnesium glycinate or magnesium citrate for maximum results. Quick tips to get started today. Always check the label. Make sure you're getting pure magnesium glycinate or citrate without unnecessary additives. Start with lower doses. Gradually increase until you find the amount that feels best for your body. Consistency matters. Take your magnesium daily for sustained bone strengthening benefits. And remember, adding magnesium doesn't have to be complicated. Just making this small adjustment to your daily routine can quickly lead to big improvements in your bones, energy levels, sleep, and overall well-being. Now, supplements aren't the only way to get magnesium into your body. In fact, some delicious foods are packed with magnesium naturally. Let's quickly explore the best foods to boost your magnesium intake, plus easy meal ideas that you'll actually look forward to eating.